Thanks so much for joining us. As doctors across the country raise the alarm about an overstretched healthcare system, provincial and territorial health ministers will meet tomorrow face-to-face with their federal counterpart in Vancouver for the first time since 2018. BC's Health Minister Adrian Dix is co-chairing the event, and I spoke to him about the calls for increases to healthcare transfers and who the provinces really want to meet with. Minister Dix, nice to see you as always.
It's great to be on the show, Rosemary.
So I know your counterparts and Minister Duclos are going to sit down and start talking about, or further talk about healthcare this week. Minister Duclos has said that he wants to be an ally to provinces, but it's clear, given this ad campaign that the premiers have launched, that things are getting maybe a little tenser than they had been in the past. What is the approach, do you think, that provinces need to take here in trying to elicit both a sit down with the Prime Minister and some actual action, some money behind it?
Well, we've been seeking that for many months. A negotiation with the Prime Minister, Premier Horgan, when he was head of the Council of Federation, worked on that for pretty much a year. And the federal government has not been willing to do the work to come to the table and to sit down, prime ministers and premier, and talk about, I think, one of the central issues facing the country. And so that's disappointing. We've never seen this level of unanimity. So you talk about the ad campaign. The ad campaign came after 10 months of asking for a meeting. And just so people understand, Premier Horgan has worked closely on innumerable files with the Prime Minister in his time. Premier Eby has the same approach. So we are absolutely willing to work with the federal government. But this idea that with national issues and issues facing healthcare in every single province and territory in the country, that the federal government can just sort of play a defiant game and play games around this. They need to come and meet, and the Prime Minister needs to come meet in the premiers. And the Prime Minister is not a potted plant. He can defend his position if he wishes, but there should be a meeting. And so we'll be delivering that message. That hasn't stopped us, of course, from continuing to work together on healthcare issues, notably COVID-19, notably the public health emergency that's the overdose crisis in BC, and issues like health human resources. But it is kind of a fundamental underlying question about how we support and finance a healthcare system across Canadian provinces and the role of the federal government in that. And I don't quite understand the Prime Minister's position. I very much respect Minister Duclos, but I do not understand the Prime Minister's position that he doesn't want to sit down and do the work.
So could it be, though, that the Prime Minister wants the work that is being done with Minister Duclos and the people at your level around the table a little further along in terms of a solution before it gets to his level? And if that were to be the case, where would you say those conversations lie in terms of your counterparts? I mean, have you made headway on any conversation around financing?
Well, honestly, they're not at the table for any serious conversation about financing. They're simply not. Okay. And for them to suggest they're waiting for something is wrong. In the last 2 months, we've tabled a health human resources plan for the future of BC, a 10-year plan with 70 actions. We've changed the way we provide security, or changing the way we provide security in acute care hospitals. We've signed a major deal with doctors that fundamentally changes primary care. We've had massive investments in long-term care. We've added 600 new nursing spaces. We're doing the work, right? So when people say further along, I mean, the federal government's role, in a very significant way, they have other roles in healthcare, as you know. Their significant role is to jointly support and finance a system where we can support Canadians everywhere they are. And at the end of this, as we go through this stage of the pandemic, we're not at the end, but this stage of the pandemic, the pressures on that healthcare system after 2.5 years of this are enormous. So where are they? I keep hearing about preconditions. They're not talking. They don't want to meet. They need to meet. They need to change their view on that. And I don't quite understand, frankly, their position. If the suggestion is that we're going to have at the provincial and federal level, at a health minister level, full-on meetings about the Canada Health Transfer, I would be delighted to have those. But frankly, that is not what's been on offer from the federal government.
Okay, so let's talk about conditions of any kind, assuming you get to the conversation you want to have, and I take your point that it is not happening. When I talk to some of your colleagues and other premiers, there is a willingness to talk about conditions, particularly even things like so long as the money stays in the healthcare sector or some other conditions, some other strings attached to it. How open are you to agreeing to some ideas of conditions around how this money has to be used?
Well, that's the new federal position, that we won't talk without preconditions. And I think Canadians are frankly tired of that discussion. They need to come and initiate a process that's serious on this question. Like in British Columbia, we get about 21% of healthcare funding from the federal government, right? On an initial, and there's all this discussion that say, oh, there's tax points and everything. That's what we get. Yeah. And that's out of what was expected to be a 50-50 partnership. And that has been declining over time. And it's been declining over time because inflation in healthcare is above the increase in the Canada Health Transfer. So not only are we not getting to deal with the emerging situation and the crises facing many healthcare systems, it's actually declining. And so, it's a bit, I think, preposterous. I always think these discussions of conditions are preposterous. We just announced a deal with doctors that transforms primary care, that's $704 million, right? And if the federal government wants some credit for that, I'll give them credit, including 21% of that credit. But honestly, we saw one of your colleagues, I think Ms. Raj, who works for the Toronto Star, is on your panel. There was a story in there that was leaked from the PMO, and this is just childish. It's just childish. We need them to sit down and work. We have a prime minister who's very experienced, who understands these issues. He needs to sit down with the premiers, and we're not. I haven't heard of any preconditions from premiers or health ministers to those discussions. The only people who are now talking about preconditions are the people who haven't been responding for 10 months to our request for a meeting.
I want to ask about your compensation model for family doctors, if I can, because it has gotten a lot of attention because it is significant and it has been very much welcomed by people in BC, including, I think, family doctors. I wonder how much it will help people in BC find a family doctor. And then I wonder this too, Minister, whether it's not going to set up a sort of competition between provinces for doctors. And then you risk sort of bringing all the doctors to your province and other provinces are stuck because you've made some significant changes to the system. Any concerns around that?
And it's the opposite of what we want to do. What we want to do, and it's significant, is to work with all provinces because we're all facing the same issue, and not just with doctors, but with nurses, with allied health professionals, with healthcare workers. That kind of competition isn't helpful for any province. What we did in BC was we've had a compensation model and a primary care system that didn't work for patients, didn't work for doctors. It didn't consider the complexity of patients, and with an aging population, that's a significant issue, or the time doctors actually spent with patients. And our younger doctors didn't want to do it. They didn't want to set up businesses all the time. They wanted a different compensation model. So we worked together over months. We provided interim funding to support doctors with overhead. We provided a new model for new to practice doctors to encourage them to be part of full service primary care. And now we have a different model for the payment of doctors, one that reflects the work that they do. And one, I think that in particular, the new doctors we need to come in, whether they're trained internationally or they're trained here in Canada, are going to want to do.
Minister Dix, always good of you to make the time. You're always very frank, which I appreciate, sir.
I'm delighted, and like I say, we're going to have all the ministers here, and obviously we want to get some things done.
Okay, thanks, Minister. Appreciate it.
Thank you. Take care. Good to talk to you, Rosemary.